All right, good evening. This is Mrs. Ignacio, and we have a motivated group tonight. We are going to be talking about foundations, so foundations topics. Before we jump into the topics, I just want to share some resources with you. Some of the questions that were asked were about how to study, how to break things down. So I do have a Google Classroom with a lot of pictorial study aids. I really like it. If you're a visual learner, this would be a great resource. I'm putting the link in the chat. So you can definitely use these. So let me give you an example of what these pictorials are. So I know in foundations right now, you're probably going to be learning about sensory alterations. So here's an example. You're probably going to be talking about glaucoma, cataracts, hearing deficits, those kinds of things. So these visual aids kind of give you pictures, they give you signs and symptoms. They also give you, sometimes the nursing interventions, things that you need to look out for. So this particular pictorial is about blindness due to open angle glaucoma. And so the 3 Ps is preventable, painless, and permanent. So the patient may not even know that they have glaucoma unless they have their eyes checked and they have a high eye pressure. All right, welcome, Tiffany. I'm just going through some things here, and we are going to be talking about foundations. I just want to make sure you're in the right spot. If you have any questions, please put them in the chat. So here's another pictorial, and that's the link that I share with you so you can have access to these pictorials. If you're a visual learner, it'll be very helpful. So here's beta blockers for glaucoma. That's going to be something important to understand, not only the pathophysiology, what's happening in the patient's body when they have a particular condition, but now how do we treat it? And that's how you always want to think. Okay, so that's one kind of resource that you have, and that was just an example because I know in foundations you're going to be talking about sensory deprivation, sensory deficits, and sensory overload. And let me address that really quickly because that was a question that Jackie asked. So when we have sensory overload, I think of my autistic patients. I think of patients that there's too much stimuli. That could also be a neurological patient, like a patient that has maybe epilepsy, they're on seizure precautions. It could be a patient that has preeclampsia. I have to minimize the stimuli. And what do I mean? Well, no loud noises, not a lot of light. So they'll be not close to the nurse's station because there's a lot of noise by the nurse's station. So if a patient has sensory overload, we want to reduce their environmental stimuli. So this is not the time to be blasting your gospel music or your heavy metal or your reggae music, whatever you want to listen to because that patient has too much, okay? Not a lot of visitors, not a lot of traffic because the patient has sensory overload, okay? And if it is due to a neurological condition, we also want to keep in mind that we're going to be continually doing our neurological checks. Okay, so when we think about a sensory deficit, that is a patient that may have issues with their hearing, issues with any of their 5 senses pretty much. But I think for you all, you're focusing on your visual for your vision as well as your hearing. So that could be hearing loss. It could be some kind of sensory issue going on in the inner ear, the middle ear. So there's some kind of deficit there. And when we talk about vision, it could be blindness, it could be a loss in vision. Maybe this patient that has these sensory deficits, they have assistive devices like a hearing aid, like glasses. And so the role of the nurse is to make sure that the patient has all of those assistive devices. The patient knows how to use them. They're within reach. And especially if it's like a hearing aid, we want to turn it off at night, take it out, make sure that we put it in a marked container with the patient label. Don't ball it up in tissue because that's not going to work out well. It can be thrown away. Um, so those are the kinds of things you have to think about. And when you are utilizing critical thinking, you're not just memorizing facts. That's really not going to help you. What you need to do is understand the information and then take it to the next level as, okay, now that I know this, what do I need to do as the nurse? How does this affect how I care for the patient, right? So I'm going to pause for a second to see if everyone has access to this Google Drive. Anybody have any questions?
No, not yet.
Okay, fantastic. All right, so I'm going to put in the chat some links of videos that I actually really enjoy, and I have actually watched a majority of them, although they're getting new videos, it seems, all the time. So Kathy Parks with Level Up RN, she has an excellent YouTube channel, and she has been updating her resources. She really has been updating her resources. She used to be by herself, but now she has a team of a couple other nurses that are working with her to update this information. So she has really great pharmacology cards I would recommend. When I bought them, they were about $36, and that was just a couple months ago. The price may have went up a little bit, but it's definitely worth the investment. So Kathy Parks Level Up RN, pharmacology, flashcards, and her videos actually go along with these flashcards. So Remar, if you all have seen some posts on Dean's Corner, I love Remar. She has a lot of free reviews, and you don't have to buy anything that she's offering because she has a lot of free stuff. And she really has great workshops. She just did the maternity workshop 2 days in a row for Valentine's Day. She does a lot with pharmacology, and she really has motivational Mondays and winning Tuesdays. So she's also a great resource that I definitely recommend. If you have test taking anxiety, she does have a test taking anxiety workshop as well. It's about an hour and 45 minutes long, but it's really, really beneficial if you think you have test taking anxiety. Okay. Okay, let's see. All right, welcome, Lakeisha. I'm glad that you're here. If you have any questions, you can jump in, or you can unmute, or you can put them in the chat, okay? All right, let's see. All right, so the next resource I'm going to share with you for pharmacology is the MedMaster podcast. This is by nursing.com. So this is a great podcast not to listen to when you're driving, but it's really good. Like if you're around the house, doing dishes, like some of you are right now, folding laundry. It kind of walks you through the most frequently seen medications. It gives you the name that you're going to see on the NCLEX, and it gives you the therapeutic reason why a patient would take it, the nursing considerations, the patient teachings, any contraindication. So this is really great. And it's about 2 to 3 minutes per medication. And I guarantee you, if you listen to this over and over and over and over again, it's going to start to stick. So this is the MedMaster podcast by nursing.com, especially if you are an auditory learner. All right, I am going to go now to the Kaplan Decision Tree because we're going to talk about these test taking strategies, because that's one of the questions that you all asked about. Okay, how do I break down these
Exactly what
questions?
I was talking about, Miss Ignacia. But go ahead.
Okay, all right. So I'm glad I'm on the right track. Okay. Just send over some electronics. Okay. I'll take a look at it. Definitely. Okay. So when we talk about the Kaplan decision tree, I really like it. And unfortunately, sometimes we don't get it until the end of the program, but I try to use this as much as possible in any class that I teach, usually on the first or second day, because I want you to start incorporating it and start thinking this way, especially with next generation NCLEX. It's going to be important for you to take your thinking to the next level. So when you get a question, first of all, when you read the question, take your time and read the answer choices, and then ask yourself, can I identify the topic of the question? What is the question asking me? Is this a positive question or a negative question? Positive question meaning that this is something the nurse should do, or this is something that the patient should say because they understand teaching. If it's a negative question, that means that there's intervention that needs to happen. So the charge nurse needs to stop this new nurse because she's inserting a Foley catheter after she contaminated her sterile field. That's what we're talking about, a negative question. So sometimes we miss questions because we don't identify that, whoa, this was a negative question, meaning the nurse should not be doing this, or the patient should not be saying it. Okay, so identify the topic of the question and then ask yourself, are the answers assessment or implementation? Now, this is important. And so with my foundations or my basic skills students, I'm always talking about ADPI. Even at orientation, started talking about ADPI. You got to always think in terms of ADPI. And when I say ADPI, what do I mean?
The nursing process.
Yes,
Oh,
the nursing process. And so not Jackie, somebody else, because I know you know this,
oh,
Jackie, because I've had you as a student, and not Lakeisha, because I know she knows this too, but someone else.
the physical, like assessment, the diagnosis. Are you talking about in that
Yes, yes,
direction?
yes,
The planning,
yes.
implementation and evaluation.
Okay, go Brittany. Outstanding. So yes, that's what I'm looking for, and that's how you should always think. If you look at your textbook, especially your med surg textbook, you're going to, when you talk about, alterations in particular body systems, it's going to give you the A and P. It's going to give you what's happening at the cellular level, the pathophysiology, and it's going to give you like, definitions of the different conditions. And then there's going to be a section where it says assessment. Okay, how do we look for this? So if I'm looking at sensory system, because that's, I think, the next topic that you all are facing, how do I assess my sensory system? What are the hearing tests? And so you should be familiar with your cranial nerves, right? If you're not, you got to brush up on your cranial nerves because that's a part of your sensory system. Because when we think of our five senses, our cranial nerves gets information from those senses, right? And sends it to the brain. Okay, and I will show you a picture of the cranial nerve funny face in case you don't have that, because that's important. So when you get this information, you're assessing, right? And so I'm kind of going through AdPi with this particular sensory. And here's a quick plug. Last night, I think it was last night on Dean's Corner, I posted a really cool video series that I never saw before. And it talks about AdPi with particular medical diagnoses. There's about 7 or 8 videos. And I think it's just simply fantastic because, and the reason why we're searching for these videos is one of my students Friday night said, I really don't understand the nursing process and how to apply it. When I found those videos, I was like, whoa, this is solid gold. The videos are by osmosis. And what it does is it breaks down the nursing process, but in accordance with that particular condition. So for the sensory system, when you are studying and learning about it in class, I want you to think, okay, what is the anatomy and physiology of the sensory system? So think your eyes, the parts of the eyes, right? Going back to your anatomy and physiology. Think your ears, going back to the external ear, middle ear, inner ear. And you really got to understand the anatomy and the physiology. And then you're going to go into the nursing process, okay? The assessment. How do I assess the eyes? Well, I know that I use the Snellen chart, right, for visual acuity. I know that I test for Perla. I know I check for the 6 cardinal directions of gaze. Those things that you learned in health assessment. That is your assessment. For hearing, you should be familiar with the Weber test, and I'm going to put that in the chat in case you haven't, if you're not familiar, and you should be familiar with the Rhine test, right? So visual acuity test. So you should be familiar with all of these things. Okay, and so as you study, that's your assessment piece, right? People's equal round reactive to light and accommodation. And then the 6 cardinal directions of gaze. Okay, and so now when we think about the diagnosis, what you all are going to be learning about are medical diagnosis, but you also need to think about the nursing diagnosis. And that's how the patient is responding to their medical diagnosis that tells us, okay, so let me give you an example. The patient may have glaucoma, but the patient, that's going to be the medical diagnosis, but the nursing diagnosis may be at risk for falls due to, visual deficit. So they have this medical condition, but now we have a nursing diagnosis. And you all should have a NANDA book. Everybody have it? Does anybody not have a NANDA book?
I don't think I got a NANDA book. Do you know the name? I don't think I have one.
It should say nursing diagnosis. It's white and it has like red
Oh,
and
yes, I do
this.
have one. I'm sorry. Yeah, I do have one.
Okay, so that's okay. I feel like that book might still be in the plastic for you, and that's okay. open that book up, because when you open it up, you're going to see, oh, this is the nursing diagnosis piece. And that's going to really come into play a lot when you get to clinical. I know you're not there yet, but that is what we're talking about when we talk about NANDA, that nursing diagnosis. Okay. And there's 3 pieces that go with it. Okay. But that is when we talk about ADPI, the diagnosis is the nursing diagnosis. Any questions?
No, I'm actually using that book right now. Miss Innocent is helping us use it in clinicals.
Yes, I love Miss Innocent. Okay, fantastic. But yes, and you will see that in clinical, because you're going to go into, the 3 parts of the nursing diagnosis, which is your problem statement, your signs and symptoms, and your etiology. But you'll go into that in the clinical setting. So that's great to hear that you are having that experience. Okay, so I'm still talking about ADPI, and so planning is the P. What are you going to do for the patient? Okay, you're going to gather your medications, gather your resources, and when we implement, we're actually going to do all the things that we planned. And now that we've done all of these things for the patient, now we're going to evaluate, how were my interventions received? Because I set short-term goals and long-term goals. How did those actually work out? Okay, so that is ADPI. So when we look at step 2, are the answers assessment or implementation? I need to ask myself, based on what's given to me in the question, do I need more information, or do I have to do something? So here's an example. Your patient is having a blood transfusion and they start to have difficulty breathing. They start itching, right, which is pruritus, and they also they have itching, yeah, which is pruritus, and then they have hives, which is urticaria. So what do you have to do? Is this an assessment or is this an implementation? Anybody?
That's the assessment, what you're doing.
Yes, so the information I gave you is assessment. So now I have to do something, right? I have to stop the transfusion because those clinical cues tell me that this patient is having a transfusion reaction. Okay, the patient is having a transfusion reaction. So that's what we're talking about. Are the answers assessment, meaning I need to gather more data, or implementation, meaning that I have to do something? In that particular question, I had to do something because I had to recognize the clinical cues were saying that the patient is having a transfusion reaction. Okay. Any questions about that? Step 2?
No.
Okay, awesome. Step 3, apply Maslow. Are the answers physical or psychosocial? If you are not familiar with Maslow's hierarchy, you have to be. That is going to be a part of what you need to understand. And your questions really won't say, okay, in accordance with Maslow. Well, sometimes I've seen some test questions on ExamSoft say that, but usually your NCLEX questions won't say, well, in accordance with Abraham Maslow. It will be understood that that is what you're using to prioritize. So when you see Maslow, you should think prioritize. How do I know, Mrs. Ignacio, that this is a prioritizing kind of question? Well, you will see, what will the nurse do first, or what will the nurse do immediately? What will the nurse do next? Those are all, telling you that, okay, this is a priority and I'm going to be using Maslow. And the thing that's important is we have to take care of the patient's physical needs before we can meet their psychosocial needs. So Maslow's hierarchy, if you're not familiar with it, write it down, look it up, because you definitely have to know and operate with that. So that's your clothing, your food, your shelter, your basic needs. And then step 4 even talks about the ABCs. What do the ABCs stand for?
Airway, breathing, and circulation.
Yes, excellent. So you need to understand that those needs come first, because if I have a patient that's depressed, or if I have a patient that has an airway issue, I better see that patient with the airway issue first. If not, then they're not going to be alive, right? So that's what we're talking about. If the answer choices are related to the ABCs, then we need to choose that if that's the scenario that's going on with the patient. The next step is, what's going to be the outcome of the remaining answers. So a lot of times when you have these test questions, you may be able to read the question, understand what it's asking you, and then eliminate two choices. You're like, man, those two are no good. I have two choices left. And then you're going to ask yourself, if I was to choose this answer, what would happen to my patient? What would the outcome be? Then the next question would be, okay, the other choice. Well, if I was to make this choice, what would the outcome be? What would happen to my patient? And that way you kind of think it through, and that's a part of critical thinking. And then you can say, okay, I'm going to choose this answer because that's going to be the best outcome for my patient. So if you think like that, using the nursing process, you are more likely to choose the correct answer and to be successful. Lastly, you're going to ask yourself, if you could do one thing and you had to leave, what would that one thing be? Okay, so or ask if that's one thing, what's the most important thing? Or you can ask yourself, what is the killer answer? The killer answer. If I do nothing about this, this is going to kill my patient. Okay, what is an unexpected finding? That is something that I need to report. So that's how you should think when you see these NCLEX questions. And of course, your exam questions as well. Any questions about this Kaplan decision tree? Okay, all right, I'm going to go into sensory, and as I pull up sensory, I just wanted to talk to you a little bit about how you should study. So you may be feeling overwhelmed because with med-surg, or I'm sorry, this is not med-surg, but with foundations, you may have a number of chapters that you're having to go over. So as a teacher, I will never say, oh, don't read your chapters. Teachers will always tell you, read all the chapters. You're responsible for all that material. But what you can do in order to maximize your time and to help you is before class, if you know the teacher is going to lecture on a particular topic, and so I think you all told me chapter 49 is like one of your chapters, go to your book, look at the end of the chapter, and there should be the key points and the summary. Look at the key points. Okay. Yes. Okay. So look at the key points and look at the summary before class. And so you can kind of say, okay, this class is going to be about this. So you kind of have an idea before you go into the class. And so when the teacher starts lecturing, you're like, oh yeah, okay, now it's clicking, it's starting to make sense. If you are a visual learner, not only use these visual aids, but tell your teacher, you know what, Mrs. Professor or Mr. Professor, whoever your teacher is, I'm a visual learner. And what they can do, because I do this a lot of times in my class, and I'll give you an example. If we're talking about macular degeneration, so as I talk about it, I talk about, okay, this is central vision loss and that kind of thing. And then I pull up a picture so my students can see, hey, this is what I'm talking about for central vision loss. So on the left is a picture of what a normal patient with normal vision would see. And this is my patient with macular degeneration. And so you will remember this, especially if you're a visual learner, you're going to remember this. And that took me all of like 30 seconds. So that's something that you could, if your teacher doesn't have the time to do it or that's not their style, this is one way that you can study. And so you may be saying, okay, yeah, that's fine for vision. So let's talk about congestive heart failure. One of the signs and symptoms that goes along with it is clubbed fingers. And if you don't know what clubbed fingers are, you look it up, you're like, oh my goodness. When you see this, you're going to remember what club fingers are at this point, right? So that's just another way that you can study, especially if you're a visual person. And if you know that maybe you need to do this pre-work before you go to class, then go ahead and do it because you can kind of skim through those key points and that will help you. Okay, I'm going to pause for a second to see if anybody has any questions about that.
I don't at the moment.
Okay, all right. Thank you for letting me know. But if you haven't been doing that, go ahead and try to do that before your classes start this week. And try that for all of your classes. Even if you're taking online classes, if the teacher has already given you the PowerPoints or if they've given you like bullets or something, just skim those ahead of time because you're doing the pre-work before you go to class. That's going to be really important. The other way that you can really focus your studies is at the beginning of the chapter, they have objectives. And that tells you, okay, what am I supposed to be getting from this chapter? Okay. And so as you skim through the chapter, right? But again, you should be reading. But if you skim through the chapter, you can say, oh, this is objective number 1 right here. And you can highlight it. You can mark in your book and even put tabs and go back to it. And I would recommend, and I do this all the time, is when the teacher is lecturing, have your textbook. And when the teacher mentions this condition, oh yeah, I know it's on page so and so in my textbook. And I can kind of listen and maybe look at the pictures when the teacher is lecturing, and that will help me. And then I'm like, oh wait, no, I made a mark in my book. I don't understand that point. And that would be a great time for you to ask the teacher about that particular topic that they're talking about. So that's just one strategy. Now, for you all, you have a test coming up. You have some concepts that you're going to be going over. And I understand that it's a lot of sensory kinds of things, okay? So I'm going to talk about that tonight. With the time that we have remaining and giving you some things that you should study for and look at, okay, that will help you kind of with this particular topic. All right, so when we think about sensory and sensory deficits, I really want you to think neurological assessment, and that means you have to know your cranial nerves. Do you all remember your cranial nerves?
Oh yeah.
Okay, good. Okay,
So far, yeah.
Okay, excellent. That is great. That's very encouraging because a lot of times students don't remember the cranial nerves. Okay, so I have a picture that I like to share. This is a cranial nerve funny face guy. So if you are kind of drawing blank, this is when you get that scratch paper, you can draw this cranial nerve funny face guy, and each of the cranial nerves actually is a number on this face. So 2 and 3 are around the eyes, 4 and 6 are around the eyes. Number 1 is supposed to be the nose, right? For your sensory, for your olfactory rather. And I'm going to bring up the cranial face muscular guy. And if you just Google cranial nerve funny face guy, you'll get this. Okay, and okay. So this is, okay, and if you can see the 5, that's the trigeminal nerve. 6 is going to be your abducens. And remember, 2, 3, 4, and 6 all have to do with the eyes, okay? 8 have to do with your ears, your sense of hearing, acoustic or vestibular cochlear. And then 9 is going to be your glossopharyngeal. 10, your vagus. I want you to think your internal organs, right? Your viscera. 12 is going to be hypoglossal, and you see 11 are the shoulders, and that's going to be your accessory. So let me bring, and if you like this, you will probably love this guy. This is the cranial nerve muscle guy. And I like this one, and I'm going to make it a little bit smaller so you can kind of see it, because it's numbered, but it's also labeled, okay? But now this group, you told me that you know your cranial nerves, so that's good, but you definitely need to know your cranial nerves, okay? All right, Zakia, welcome. I'm glad that you're here. If you have any questions, just put them in the chat. We're just going over
Hey.
some sensory stuff right now, okay?
Oh, okay. When we gonna go over foundations?
This is foundations. This is
Okay.
foundations. So we just went over some test taking strategies, how to review things in the chapters, how to break things down using the Kaplan Decision Tree, and what's the best way to study before you get to class. So we're going to be looking at these sensory disorders because that's going to be something that I think you have coming up. Okay. So when we think about sensory disorders, of course, we're thinking of the senses. So let's get into these conditions. So I'm going to use these for your visual pleasure, especially if you are a visual learner. And so whenever you have these conditions, I'm going to challenge you to understand, right, what the condition is. And how many of you have seen active learning templates, or they're they may be called something else? Is anybody familiar with active learning templates?
Like a Picmonic or something?
Um, it's kind of like it's kind of like a concept map.
Okay.
Let me kind of bring one. So I use one a lot with ATI. So here's an example of one. Okay, these may be really helpful, and let's see if I can make it bigger. Okay, so here's an example. Oh, this is for
Those are in
a
the back of one of our books.
Yes, so this I know comes from ATI because I've used ATI in the past, and so you can, if you just Google, this is all nursing skill, they have
Yeah, I think we
medication.
do those. We just got one of those. I think it's, yeah, like the disease process and breaking down the drugs and stuff.
Yes, okay, excellent. So if you have that, I would recommend doing that. So I see all of these for nursing skills. But they have them for medical diagnoses. So of course I can't find one right away, the one that I'm looking for. But okay, so the reason why I'm advocating this, because it's going to give you your medical diagnosis, and this is a therapeutic procedure one. It's not the one that I need right now, but this is going to be the way that you should study. So that active learning template, because you're going to write about the pathophysiology, you're going to write about the indications, you are going to write about the nursing consideration, and you're going to be using pretty much the nursing process for that each condition. So I'll have to post the active template that I'm talking about because I can't find it right now. And so the reason why I brought that up is because when you study cataracts, that's going to be really important for you, right? If you break it down that way. So what exactly is happening with cataracts? Well, the patient is going to have an opaque lens, and we know that the lens is supposed to be clear. So this is going to affect their vision. You need to know that the patient that has cataracts has a decrease in night vision. It's not painful. How do we treat cataracts? Well, this is going to be surgery, right? It's going to be surgically repaired. And so what are some of the, nursing kinds of things that I have to look out for? Well, I know that this surgery should not be painful. So if there's a severe pain that this patient is facing post-surgery, that's something that I have to immediately report to the physician. So that's how you can use those active templates, and you can use these pictorials to kind of help you through that process. Okay, any questions about the cataracts? Okay, I'm going to go to glaucoma. And I know I'm not giving you the full thing, but hopefully you have enough that you can go to the book and you can say, oh, okay, this is making sense now. Okay, so let's talk about glaucoma. What does anybody know about glaucoma?
I just know that I don't know. You got to get surgery when you have glaucoma. I don't know if they have blisters in their eyes or something.
No, they feel a lot of pressure.
Okay.
Yes, okay, and so that's good that you're saying that you're not sure, and then Jackie chimed in and said, okay, there's a lot of pressure. So when I think glaucoma, I think of increased intraocular pressure. So that's a different kind of pathophysiology that's happening with cataracts, right? Even though they're both eye issues, they're both visual issues, but what's happening to the eye is different. So that's going to be a way for you to say, okay, when you're studying, this is what I need to understand. So how would that patient with high eye pressure present? What are the risk factors? What's the nursing considerations? Well, I know that this patient is going to have to be on eye drops for the rest of their life. I don't want the patient to do anything that's going to increase their intraocular pressure. So I don't want them straining. I don't want them to be constipated. I know that they have to definitely take their eye drops, right? So these are the things, and when you are studying, that's what you need to be focusing on, okay? And then what kind of medications will this patient be taking? What medications should they avoid? So when you are filling out that active learning template that I will send to you, just so I make sure that you understand it, this is going to be how you fill it out, and that's how you study, because that is going to help you with the content information that you need. And then you can start thinking critically about, okay, what's the next step for this patient? I'm going to pause for a second to see if anybody has any questions about the cataracts or glaucoma. Okay, I did mention macular degeneration, and I showed you. So we now are going to talk about a third kind of condition, because cataracts has to do with the lens of the eye. And again, that's why I said you got to know the anatomy and physiology, because cataracts deals with the lens of the eye. Glaucoma deals with the intraocular pressure. So that is actually that fluid that is behind the eye, and that's not going to be draining well. When we talk about macular degeneration, now we're talking about central visual vision loss. Okay, so that's a whole nother kind of condition. And I will mention another condition, which is a detached retina. We know that the retina, and I don't know if I have a picture for the retina. Let me see. I don't think I do. So when we think about a detached retina, what you need to understand is the retina is that pigmented epithelium. It's the lining, it's the inner layer of the eye. It continues to the back of the eye, and it becomes or it flows into becoming the optic nerve. And so that's cranial nerve number 2. If the inner lining, that epithelial of the eye, starts to become detached, the patient obviously, right, is going to have issues with optic nerve number 2. Okay, so Jackie says on page 1399, there's a cataract concept map. Okay, awesome. So that patient is going to be facing blindness with this detached retina. That is a medical emergency. Your challenge, right, your task is to look it up. And I want you to tell me, right, and not now, but you know, when I see you next, maybe, or when you can send me a message, hey, I understand. What's the patient going to see if they have a detached retina? What's going to be the signs, the symptoms? What would I see as a healthcare provider? Okay, so, and that's how you study when you have these particular alterations. Okay, so that's going to be really, really important as you go through all of these conditions. So detached retina, what will the patient see? What are some of my nursing considerations, patient teachings, all of those kinds of things? And I'm going to tell you, anything with the eyes, you don't want to increase the pressure in the eyes. You don't want to increase their cranial pressure. You don't want them to be straining or lifting anything too heavy. Okay, so that's how you should be thinking about these topics. Any questions about that? All right, otitis media, we're going to switch real quick to the hearing. So something that's really important when you have sensory deficits, I want you to think there's the external ear, there's the middle ear, and when we think ear, think oto, and when you think itis, think inflammation, and media means middle. So this is a middle ear infection. So something that you need to know as you're going through and studying, what is actually happening? I want you to look up pictures of what does it look like for a normal eardrum, a normal tympanic membrane. You have pictures in your textbook. You should be able to know, okay, this is what a normal one looks like. So when I look at one that's infected, how is it going to appear to me? How will the patient appear to me? if I have to instill eardrops, how do I do it for that patient that's 3 years old and younger? How do I instill eardrops for my patient that is an adult? And the same thing goes with eye drops. What is the appropriate way? Because those are the things that test questions are made of, okay? I'm going to pause for a second. We've got 3 minutes. I'm going to see if anybody has any other questions so far. Okay, so let me just touch on some of the nutrition things. So when we think about nutrition, you have to know the difference between parenteral nutrition and enteral nutrition. And I'm sorry, I didn't mean to put that in. I didn't spell it all the way. So you have to understand the difference between those two kinds of nutrition because they are very different. Okay, so and you should also know what TPN is, total parenteral nutrition. So I'll tell you, so you can know that you're on the right track. When you think parenteral nutrition, I want you to think, and I'm going to stop sharing my screen right now. When you think parenteral nutrition, I want you to think IV, total parenteral nutrition. This patient is not able to eat anything by mouth. So they're receiving all of their nutrients and vitamins and minerals through this central line. And so when a patient has a central line, that is something that has to be surgically installed and it stays in place for an extended period of time, but I'm always worried about infection. And sorry for the typo. And so when I think of enteral route nutrition, I'm thinking of a patient that has some kind of feeding tube, like a PEG tube, some kind of tube that's going directly to the gastrointestinal system. Okay, so when we think of nutrition, those are the things that you have to think of. You also have to think of the different diets. Okay, and what do I mean by different diets? Heart healthy diets. If the patient is a heart patient, they need to have low sodium, maybe a mechanical soft diet, right? So that's what we're talking about when it comes to, nutrition. You also have to understand, and I'm going to just share with you because Kathy Parks has a really great set of videos on nutrition. I will just say, look at Kathy Parks' videos on nutrition. Let me just share my screen because she talks about fat soluble vitamins and minerals. Okay, so nutrition, and you probably know this already, but I'm just trying to also give you tips on how you can study effectively. So Kathy Parks, I am sharing my screen, I hope. Let's see, macronutrients, fat soluble vitamins. So she actually has just one playlist of nutrition essentials. And so that's would not be a bad thing to look at before your class. So you can kind of, be ahead of the game if that's possible, if you have time to do that. And Kathy Parks is pretty lively, so this is something if you feel safe, if you could drive safely just listening to it, or, as you're washing dishes again, you can have this on in the background. Okay, and my time is up. So I am going to stop here and see if anybody has any questions about just a really whirlwind kind of introduction to some things for foundations and how to get you to study. And I'm going to go to Brittany for some feedback.